and today we're going to cover what our postural assessments entail. So the postural assessments are really an engineer or biochemical analysis of the body that helps give us data about what's going on with a person's neurological system, the muscles, bones, tendons, cartilage, all that stuff. And applications include personal training, of course, athletic performance, ergonomics, corporate wellness, and injury prevention, athletic performance, any of those subcategories. So with it, what we do is we find out what the engineering kind of flaws are in the body, and then that helps decide what the exercise program is going to be, whether it be for a pro athlete that's injury-free or for a person that's got pain in their back or their knees, or someone that's just trying to get in shape without pain. So when we work with muscles and bones like this, we need to know what they're doing, how they're functioning, where their weaknesses and strengths are at. So by performing this gives us a tremendous amount of data without spending a lot of money on analysis and doing x-rays and MRIs and all kinds of stuff. We can see most of what we need to just from the visual analysis and taking several measurements. But again, all this data will be used to help create your program. Without it, I believe that an exercise program is not useless, but significantly less effective compared to actually having the correct data to implement the program. So let's start covering the analysis. So we like to use a plumb line, so a string with the weight on the bottom represents center of gravity or pull of gravity. So essentially this is a really cheap level, carpenter's level, typically used currently in masonry work. It's used to build pyramids to make sure things were parallel with gravity in line, so therefore structurally stronger in that position. So we use this to take some of our measurements, but not all of them. We use a couple different tools. One of them is a goniometer. All this does is measure angles used in engineering. And so we'll go ahead and start with this. And so we start with the feet, and we look for rotation of the feet. So most people, when they stand, tend to rotate their feet outwards, not inwards. The combination of rotating your feet outwards and then also bearing weight on the inside border of your feet is known as pronation. Most shoes are made for pronation. They tend to build the inside border up of the feet. The problem with that is that it tends to make the nervous system and the muscles weaker, thus leading to foot problems, a number of them knee and hip issues. So the long-term solution to correcting foot pronation is not shoes, but actually identifying the issue and then putting on stretches and strengthening exercise to help correct that, to bring that back into a neutral position. And the neutral position for the feet is actually parallel. Depending upon what books you read, it'll say plus or minus 5 degrees of internal or external rotation. I would say our average client that we've had over the last 30 years has a minimum of about 10 to 20 degrees of rotation outwards, or sometimes inwards. But usually we'll find the feet rotate outwards. So we'll use this goniometer tool to measure how many degrees the foot is rotating inwards or outwards. Then we also check what we call inversion and eversion. And so what we do here is we place the goniometer on the lateral border of the foot, also touching the lateral ankle bone, the outside ankle bone called lateral malleolus, and then we get an angle there. And that will tell us if the person's inverting or everting. In other words, if they're bearing weight on the inside of the foot or the outside of the foot. And the combination of those can lead to supination or pronation. And that gives us important data on how to design your exercise program. So from there, we move up to the patella, the kneecaps, and the femur bones. And so to check the rotation of those, again, we're placing our goniometer against the patella, the kneecap bone. We kind of think of the patella as a smiley face. In fact, in learning how to measure this area, you put a smiley face on it, 2 eyes, a nose, and a smiley face, and that helps you kind of determine which angle it's rotated, inwards or outwards. We take that measurement, write it down, and that gives us data about what the muscles are doing in the lower back, the glutes, and the hamstrings. So there's a lot of internal and external rotators in those muscles. And so if we find these rotated out, there are a specific set of muscles that are too tight, and there's another set of muscles that are too weak. And so we typically address tight muscles, obviously via stretching, and weaker muscles via strengthening. And it's different for everyone, so it has to be analyzed, it has to be measured in order to determine what your actual rotation is at each given point. So the neutral position for the knees is to be straight ahead. So the feet and the knees should be pointing directly straight ahead. Next thing that we look at is we look at hand rotation. So we place the goniometer against the ulna and radius, the 2 arm bones there, and measure if the arm is rotated inwards or outwards. A vast majority of people rotate inwards, and most of that is occupational. Most of our jobs require us that we rotate inwards using keyboards, mechanical equipment. Most of those duties requires to shorten the pectoral muscles, the bicep muscles, and the lats in order to bring the arms inwards. And so when this happens, like the other muscles in the body, one muscle group gets too strong, that nervous system actually gets overly activated, and it sends a reflex to turn off the opposing muscle group. So what tends to happen with this arm rotation inwards, as we see in almost everyone, is that the trapezius muscles, the upper neck muscles, and the mid-back muscles, trapezius 1, 2, 3, rhomboids major and minor, tend to get really weak, along with the triceps, and the opposing muscle groups tend to get too strong and short. So we're going to strengthen those upper back muscles and the tricep muscles and elongate the pec muscles, lats, and biceps in order to bring balance in there and to get rid of this rotation. This rotation is usually commonly associated with thoracic outlet syndrome, T&J neck problems, golfer's elbow, tennis elbow, carpal tunnel, and there's many other symptoms. But usually when you're in that position, you're not only inefficient and weaker in that position, but it can also lead to injuries, not only to tendons, ligaments, but also wearing out the cartilage that is on top of the bones, the bony ends themselves, which release a lubricant called synovial fluid. And when those joints start to wear down, then they start to go bone on bone, you start to have a lot of problems. So by putting these bones back in the correct position, we eliminate that problem, increase the efficiency, decrease the chances of injury. Okay? The next point we'll look at is the AC joints, the acromioclavicular joints, the shoulders. And so we use another tool that's very similar to the carpenter's level, except it's a medical level. It measures angles, and it also measures whether it's perpendicular or parallel with gravity. So what we do here is we check to see if one shoulder is higher or lower than the other by using this leveling device. And what we'll usually find is that the dominant side, let's say that you're right-handed and you're on a mouse all day long, or you're a quarterback or a pitcher, we'll find that whatever your dominant side is typically lower, the side that's overly usually tends to drop downwards. And so that's kind of important in evaluating an exercise program to do. It can't be a generalized exercise program. It has to be something very specific that corrects these things. So out of 10,000 exercises, what 2 or 3 things will eliminate those issues? Okay. So next measurements we take are at the umbilicus, so the belly button. So we check to make sure using a ruler that the umbilicus is lined up directly with the center of gravity of the string. And if we find that it's off to one side or the other, then we note that down, and then we'll apply exercise to eliminate that deviation. That deviation again will lead to asymmetrical load bearing that can damage your tendons, ligaments, and joints, along with making the muscles far more inefficient. The next point we look at is the mandibular symphysis, so the center of the chin. Some people like to use the nose. If the nose is broken, then it's not the correct position. So the ideal marker is the center of the chin, so we'll make sure the center of the chin is actually lined up with the string. And once in that correct position, we know that the neck is bearing weight pretty evenly from that position. What we'll typically find on the dominant side, though, is the person will tend to lean their head in that direction. And so that's not a good thing. So when these asymmetries happen, we're talking about hundreds of pounds of force leaning to one direction or the other. And in addition, you take hundreds of calories per hour while exercising to move this additional weight around, not to mention the damage that it has on all those structures.